name's Ben Azevedo. I'm a hospitalist and an internal medicine doctor here at Lake Charles Memorial Hospital. This week we've seen an increase in patients that have COVID-19 and we are seeing that the vast majority of them are getting better. So we've had some good success treating patients in the hospital, and the patients that I've been seeing have been making a good recovery. We have not reached the kind of numbers and cases that you see in places like New Orleans or New York. We still have plenty of bed space. We have great staff that's doing a lot of good work, and we are not being stressed out by numbers. We still have plenty of ventilators, we still have plenty of ICU beds, and we're feeling confident that we can continue to take care of the patients that need us. At Memorial Hospital, we have 2 separate floors that are dedicated to patients that have coronavirus or are at risk, or we think they might have coronavirus, and we're keeping those patients separated from other hospitalized patients. On those floors we have a specialized team of nurses, aides, technicians, and doctors that are looking after those patients. When I come onto that floor to see my patients, I put on protective booties over my shoes, I put on protective head covering, I wear safety goggles and a mask, and then before I go into every patient's room, I put on a full protective equipment gown, double set of gloves, and a face mask to protect myself. And that's the standard protocol for all the nurses, nursing aides, doctors, respiratory therapists who go into those rooms. It's been impressive what the scientific and medical community have done to share information around the globe, and I think we're learning at a very fast pace, but there's still a lot we don't know. We need good clinical trials to test out different treatments, which there's a lot of talk about what treatments are out there. We're trying some of those here, but there have been none that have been really conclusive cures for this. We're also there's a lot of work going on with vaccines to create a vaccine to prevent infection, but that's still many months away. The CDC is now recommending that people wear masks when they're out in public. It doesn't need to be a medical mask. It certainly doesn't need to be an N95 mask. Just a bandana or some sort of covering over the face, a homemade mask, will be fine. And the reason for that is that it's shown that it does save lives. Why that works is a couple reasons. For one, we know that people who are not that are infected with the virus can still pass it on despite not having symptoms. So someone could cough or sneeze and spread the virus that way. And so we're hoping that people don't do that in public. But also the main way that people get the infection is by touching a surface or touching somebody who has the virus on them, and then touching their face, meaning touching their eyes, touching their nose, or touching their mouth. Come to the hospital if you're feeling short of breath. If you don't come to the hospital, if you have a fever, or if you think you have COVID, or even if you have COVID and you're confirmed, you don't need to come to the hospital, but you do need to come to the hospital if you're feeling short of breath. If you get up to go to the bathroom and you feel short of breath, then that's a sign that you should probably come in. That's when people get severe illness, is when they're feeling short of breath, they have lung findings, and those are the patients that need to be in the hospital. The majority of people that come to the hospital are either evaluated in the emergency room and sent home safely, or we're admitting them for a few days, keeping them on oxygen, and we're able to send them home safely after that. There's a very small percentage of patients that get sicker and need a ventilator. I want to empower people that you don't need to feel scared. People are doing a good job with social distancing. I want to encourage people to keep that up. I want to make sure that people know to wash their hands frequently and avoid touching their face. That's the best way to prevent you from getting it, as well as social distancing and shrinking your social circle for now. I think people are doing a great job. I want to tell people to hang in there. We will get through this. We will do okay, and I appreciate your help.